Dr. Rosen is a native of Chicago, and after his undergraduate stint at Michigan State University, he graduated also from University of Michigan Medical School. He trained in internal medicine at the University of Alabama and in dermatology at Baylor College of Medicine. He is also the current professor and vice chair there at Baylor College of Medicine. The professor and vice chair of dermatology and chief of dermatology at the Houston Veterans Affairs Medical Center. He previously served on several boards within American Academy of Dermatology. He has written over 300 peer-reviewed journal articles, and many of his publications are within Skin of Color. And so we are just excited to have Dr. Rosen here with us today as he discusses the culture of skin lightening. Welcome, Dr. Rosen.
Hello, and it's that phrase, can I share my screen? Always, the technology is just fascinating. All right, hopefully this will show up. Looks good. Okay, that's me. So I'm honored to be invited to speak at the symposium. This is actually my second time. There was an article in the recent International Journal of Women's Dermatology by Susan Taylor, and she was talking about publications in Skin of Color. Do you know that the first textbook, all in color, about skin disease in Skin of Color was actually published in 1981. That was my textbook. The reason I wrote that was because no descriptions of skin disease that matched what I was seeing in all our institutions were available. It was all description in Caucasian skin. So I've been interested in this subject for a very long time. Now, I'm not exactly sure if I should love Pam or hate Pam because she gave me this subject to talk about. And, you know, it's easier if you're given a topic that you know a lot about and that you're already an expert on. But I had to do some research on this. You'll see some of the pictures in here are my patients, but to really understand the whole scope of this topic about skin lightening, I really had to hit the books, to be perfectly honest. So thanks, Pam. That was a good assignment, but I learned something, and I hope I'll be able to share that with you. I have no relevant financial conflicts of interest. I will be talking about some off-label things. And I think there's a real big gap here because I don't think most of us, including your speaker, really understood the magnitude and the risks attendant to attempts to lighten the skin. And here are my learning objectives, which you can look at. The last two, what's used and what's the risk, are really the most important objectives here. So this is big business. Oh my gosh. The global estimate is that $84 billion are spent on skin lightening, a lot of it in African, Asian, and Caribbean countries. 54% of that $84 billion spend are in 3 countries, the Philippines, India, and Korea. And here's a very recent survey that you can see way more women than men, but 28% of that survey from Korea, 38% from the Hong Kong, and 50% from the Philippines are actually doing something actively to lighten their skin. A recent World Health Organization survey done exclusively in Africa showed the percentages I've indicated here. These were all women, frequent users of skin lighteners. 77% of Nigerian women, almost 60% from the small country of Togo, 35%, a third of South African women, and so forth. In fact, skin lighteners in Africa are the fourth most common household item purchased after soap, tea, and milk. That's astonishing to me to learn. And remember, we have people from all of these countries who come to the United States, whether it's as a permanent immigrant or on business or to visit relatives or to study or for all sorts of other endeavors, even as tourists. So you are exposed to individuals from foreign countries, and then many will have relatives here, even if they don't intend to live here, and they might bring products from the countries they came from and introduce them to your Americans with a similar ethnic background. So how about the US? And you know, this really echoes some of the comments that have already been made by the other superb speakers. I must say, this symposium is beyond good. But the comments have been, well, we just don't have a whole lot of research. There's been no systematic study in the United States on skin lightening product use. Can you believe that? None. Now you might think, oh, well, with all the movements that are in fact celebrating ethnic skin, that this wouldn't be an issue, but it is. And this is the only thing in the literature. This is a pilot study of 76 women in New York City, about half from Africa, about a third Afro-Caribbean, so like places from like Jamaica. And the other 20% were Hispanic or Asian, more Hispanic than Asian. And some used bleaching agents, one or multiple. The ones who used daily whole body bleaching tended to be less educated and foreign born, but now living in the United States. So they're your patients. So I was sort of shocked. And then I did my own little unscientific study. I mean, just to see, is this real? So I asked every single patient I saw for a month. I didn't want to put them on the spot. So I said, do you know of anybody in your family or your neighbors, friends, or coworkers who are using any products with the intention of lightening their skin tone in a month? And then what I did was I excluded the Caucasian respondents, but I included everybody else. These are patients who are coming to me. Do you know 42% responded in the affirmative? Oh my gosh, that was shocking to me. But it is clear that the use of skin lightening agents is not only a global issue, but it is present here to some extent, as yet unquantified. But that's a pretty big number for my practice in Houston, Texas. So are these terms synonymous? Skin brightening, lightening, whitening, and bleaching? And the answer is, well, sort of, but not really. Skin brightening might just be, in fact, to make the skin less dull looking. And so things like sal acid, alpha hydroxy acid, retinoids might be used. For skin lightening, that's mild change in the skin tone. Those might be things like kojic acid, arbutin, vitamin C, nicotinamide, and azelaic acid. Mind you, I'm not talking about treating pathology here. I'm not talking about treating melasma or post-inflammatory hyperpigmentation. I'm talking about taking one's healthy skin and trying to change the tone. For skin whitening, which is more dramatic, hydroquinone, mercury, glutathione, and steroids are often used. Skin bleaching is the same thing, but you can actually totally destroy the pigment. Think Michael Jackson, and that's monobenzyl ether of hydroquinone, and various lasers can be used for all four of the purposes I've listed above. So these terms are similar, but not exactly. I'm really going to be concentrating eventually on the skin whitening and skin bleaching agents. So a lot of what I found was online, and it was very interesting. So I'm going to show you two celebrities in their own country. This is one, Sabrina Mancoux. She's a Canadian model, and she did a whole special on the Canadian Broadcasting Company. And here she is. Since age 10, she's been applying skin lighteners every single day. She's a very well-known and very successful model in Canada. And this is what she's done to her skin tone. Here's another example, Mishoza. She was a very popular South African singer, and there was a special done on her on the British public broadcasting system. Here she is getting her daily dose of skin lightening. Here she is as a teenager, a hip hop singer. And here she is 16 years later using total body skin lightening creams. And you can see a rather dramatic change in her skin tone. She was very, very popular. She died here recently of unrelated causes, but just to show you how public figures do this. And even in the United States, I think if you look at Lil' Kim, or in particular, Sammy Sosa down below there, a former Chicago Cub star baseball player, you can tell they've done something to their skin tone. And it's been intimated if you look at pictures of other US celebrities like Halle Berry, Diana Ross, Nicki Minaj, Beyoncé, Rihanna, Priyanka Chopra, who's the wife of one of the Jonas Brothers, and of course, Michael Jackson. All of these stars have been perhaps using skin lightening materials. So what's the history of this? Why would anyone do this? Well, it goes way back to ancient Egypt, ancient Greece, medieval Japan, because light skin implied wealth and status because the individuals were not working outside. And then we'll go ahead a long time, and then there's the colonial period. Think about antebellum South, apartheid South Africa, the colonial Philippines, India, Caribbean, and the entire African continent. They were ruled by lighter skinned individuals. And so light skin became associated with power and freedom. That's Africa. Other than the kingdom of Ethiopia, almost the entire continent was ruled by one or another European country at one point in time. And so the light-skinned colonial rulers became something to be emulated. In fact, lighter skin moved one closer in these colonial areas to opportunities that were only afforded to white people: privilege, higher social standing, better education, employment, and even better marital prospects. And if the only major barrier to opportunity was skin tone, why not bleach? Of course, it wasn't the only barrier. There were educational and financial barriers, but one barrier was perceived as skin tone. And then, even more recently, there's a phenomenon called colorism or shadeism. which leads to discrimination in things like income, education, housing opportunities, and again, marriage possibilities based upon the shade of one's skin. Mind you, those of ethnic backgrounds with darker skin tone aren't trying to become white. They just want lighter skin because that's associated with the reverse of all these things. Better income, better education, better housing, better marriage opportunities. And this is a phenomenon that's present now in South Africa, Jamaica, the Philippines, and so forth. Is there such a thing as shadeism or colorism? Does the shade of one's skin matter in the United States? And I'm not talking about ethnic or racial identification. I'm just talking about the shade of the skin. And the answer, shockingly, is yes. So let me give you some examples. The mean hourly wage in the United States, at least when this was studied in 2007, varied based upon the skin shade. $11.72 for dark-skinned blacks, $14.72 for light-skinned blacks, which approached the $15.94 for the average white respondent. The skin shade made a difference. Here's a study not too long ago, 2010, where it was shown that light-skinned Latino men earned on average $5,000 a year more than dark-skinned Latino men of matched country of origin. And look at this, very sad. In North Carolina, this study was done in 2011. That's only 10 years ago. Lighter-skinned Black women received shorter prison sentences for the same offense in the same state compared to darker-skinned Black women. And a study done a while ago showed that darker-skinned Black men were twice as likely to get the death penalty for the same offense compared to light-skinned counterpart Black men. And of course, this one, lighter-skinned Black women are more likely to marry early and well in this study done in 2009. So it matters, even in this country. And it relies on a very long history. So the summary motivation for why someone would lighten their skin include beauty, status, power, wealth, to be like those they admire, or as a sort of leftover from colonialism, be like those that were in charge, to increase self-confidence, perception of greater attractiveness and sex appeal, better marriage prospects, better employment, and higher social standing in the community. Outside the United States, there are very influential marketing strategies, including iconic personality endorsements for skin lightening products. I'm going to show you some billboards from Africa, India, and the Philippines promoting skin lightening. And then these are some very poignant quotes from YouTube videos. You should watch some of them. They're incredibly enlightening. This gentleman from the Sudan in Africa said, "This is how culture rooted in our community. Many people say that the lighter skin is more popular and more acceptable." Or this woman from Senegal, also in Africa, said, "Everybody pays attention to light-skinned girls." And this man from Senegal said, "Most men prefer light-skinned women." Or this gentleman from Jamaica, this is his quote, "To tell you the truth, everybody wants to bleach out white for the girls." And as you can tell, sort of by looking at him, he's using daily total body skin lightening. Or How about this? This woman who's got the yellow star is talking to a reporter. And this is what her mother told her. You're so black, you won't ever get a guy. You're so black, you won't ever get a job. Her own mother making her feel inadequate because of her natural skin tone. This woman from South Africa, people saying when you're dark skinned, you can't find a job. And this lady from Jamaica, lighter colored people are more likely to be employed, echoing what the woman in South Africa said. And this is kind of my favorite. This was an interview with the largest Bollywood casting company. That's the equivalent of Hollywood in India. And they were interviewing people to be stars on a new TV series. And these are the two people they picked. Not necessarily because they were the best actor and actress, but because as the director, the casting director said, what the clients tell us is he will need a fair complexion. That's why they picked these people, all caught on film and admitted by the casting director. Also from India, that's the same reporter. She went to a doctor's office, a dermatologist's office, and this patient said, if I am fair, I will get better opportunities. And he's got a laser that he's going to use on her very shortly. And from the Philippines, yes, I make myself whiter to increase my self-confidence, or this lady, 30% of my salary goes to my skin whitening. And you can see her paraphernalia there in the background. A third of her income for a skin whitening regimen. Does it work? Well, meet this young lady, Charlene Pega. She's 26 years old. She's a beauty and fashion media influencer in the Philippines. She has over 500,000 followers. Her income is in excess of $1 million. And she attributes her success to lighter skin, which she attributes to 2 times daily lightening regimen. She didn't go into the details, but she says she does this. Remember earlier, we talked about how much of that global spend is in just a few countries. 54%, and the Philippines was one of those countries. Now, these are popular brands of skin lighteners. And I know we're not supposed to show brands, but I think it's important for you to know some of these, especially the ones that are incredibly popular, like Lemon Vate, playing on the fact that lemon juice is supposed to be a skin lightener. But in fact, when Lemon Vate was pulled off the shelf from stores in Jamaica, it was found to have mercury and high potency corticosteroids. Topiclair, a very popular skin lightening brand sold in ethnic neighborhoods throughout Canada. Fair and Lovely, by far the #1 seller of skin lightening agents in India. Or Gore, remember that brand because I'm going to talk more about it. A very popular brand in the Philippines, and both this one, Late Max, and one more that I didn't put a clue on, the White Now, popular in Europe. And Cara White and Maxi Light are global leaders in the sales of skin lightening products. You notice there are multiple products shown for these. So there are gels and creams and liquids and foams and soaps and toners that contain skin lightening agents. But you know, you can go online today. That's what I did, and just put in skin lightening products, and you will find page upon page upon page of skin lightening products that are not the #1 sellers. They tend to be a little less expensive that you order online. But it's not just companies you haven't heard of. These are American companies that make these things for sale outside the US or international, like L'Oreal and Unilever are international. Neutrogena makes Fine Fairness. Nivea makes Extra White, a whitening serum. Garnier, you've heard their commercials on TV, makes White Speed Serum Cream. Pond's makes White Beauty, and Johnson & Johnson, Clear Fairness. All these products are designed to lighten the skin, made by cosmetic powerhouses. You don't see these products being advertised in the US. They're made for the global market. And here's a big problem. There are multiple formulations of the same brands. And sometimes the same company puts out deliberately new modifications for a very devious reason. Remember that Gore I showed you earlier, whitening cream? That was found to have mercury in it. And so it was banned. It became illegal to sell it in multiple countries. The next year, the company put out Gore Beauty Cream. It's not Gore whitening cream anymore. So it's not the same. And that's now legal. Does it still contain mercury? Yet to be determined. There are also knockoffs and counterfeits. There's a lack of content labeling, or there's inaccurate content labeling. Many of those very popular products I showed you earlier don't say anything about what's really in there when you do chemical analyses. And there are ubiquitous sources. You can buy skin lightening things. I showed you those pages on Amazon or eBay or in beauty shops, foreign product stores, flea markets, street vendors. So I went to these 4 that are here in Houston. They're beauty supply outlets, but they cater to foreign nationals, different ethnic backgrounds. And every single one of them had shelves of skin lightening products. Some of them had no country of origin listed on them. I don't know if they're real, they're counterfeit. God only knows what they have in them, or if what's put on the label is accurate or not. Remember the doctor from India, he's doing his laser lightening on this patient. But this whole process, especially outside the United States, is very, very popular and endorsed by medical professionals. So here's the Belo Medical Group in the Philippines. That's Dr. Vicky Belo. She did YouTube videos talking about how she offers scrubs, lasers, wet and dry dermabrasion, also systemic agents, capsules, and intravenous drugs. We'll talk about them in just a second, with the express purpose of lightening the skin. But it's not just overseas. This is in the United States. This individual is often offering IV therapy to lead to a skin glow. But what she's using is associated with skin lightening overtly in other countries. She's even on TV talking about it. So this is an ubiquitous problem. I want you to remember melanin synthesis for just a second, because we're going to talk about what's used to lighten the skin. And so as we go from N-phenylalanine to melanin, both eumelanin and pheomelanin, blocking tyrosinase would be an easy way to decrease melanin synthesis, decrease skin tone. But also, if you put stuff into the system like glutathione, you shift the production from eumelanin to the lighter pheomelanin. And here are the lightening agents. And I've listed their mechanism of action. You'll notice a lot of them inhibit tyrosinase, but some are also, like azelaic acid, directly toxic to melanocytes. Some, like nicotinamide and the retinoids, reduce melanin transfer. So it's still produced, but it isn't transferred efficiently. And some have multiple mechanisms of action. Glutathione, as we just looked at, has multiple mechanisms, which I'll review in just a second, but its major one is probably just shifting the pigment pathway to make theo instead of eumelanin. Steroids probably inhibit tyrosinase, but we're not entirely certain. So what determines if these are toxic? Well, how much of it? How long has it been used? How many products are used concurrently? The person's own skin sensitivity, where it's used. Is it used in places where absorption from a topical agent can be sufficient to induce systemic toxicity? And then some ambient things that might allow increased absorption, things like pollution. So kojic acid, arbutin-nicotinamide, and azelaic acid, not very effective. They're very mild, and if they're in OTC products, probably okay in the sense that the worst thing you can get is a contact dermatitis. That could either be irritant or allergic, and we can treat that pretty readily. Vitamin C itself is unstable, and its metabolite will impart a yellow color to the skin. So therefore, esteriform forms of vitamin C are actually used topically, and I've listed some of them. It's a weak inhibitor of tyrosinase and usually combined because of that with other agents. It's also given IV, again combined with other agents. Topically, there might be redness, stinging, and burning, and might maybe induce a little bit of yellow discoloration. But vitamin C by itself, not too toxic, but also not too effective. So we're going to talk about the effective ones and what their toxicities might be. So retinoids both enhance penetration of other agents. So if it's being used topically in conjunction with something else, those other agents will penetrate better. But it might also be involved in the melanin production routine. Retinoids by themselves have modest skin lightening, and they're really better at helping pathologic pigmentation than lightening normal skin tone. Of course, there might be irritation, and of course, we all know they can be photosensitizing. Older reports used to suggest that skin of color tolerated retinoids poorly, but all the recent reports refute that. And they're fairly commonly found, multiple of them or different kinds of them in low concentrations in all those popular and myriad of unknown skin lightening products available OTC. Hydroquinone, we're all familiar with. You know it's banned in the European Union, the UK, Australia, and Japan, but still allowed in the US both in 2% and 4%, the former being OTC, the latter being prescription. You can see skin irritation. You certainly can see irregular pigmentation. I'm going to show you a picture of that in just a second. But the real risk here is exogenous ochronosis. And it used to be felt that this was just seen in individuals who use very high concentration hydroquinone products, 10, 12, 15% products, which used to routinely be available in places like South Africa, where it's not available anymore. There are cases of this, US cases, largely relating to hydroquinone products, both acquired in and outside the United States. But look at surveys that are done outside the United States. Exogenous ochronosis, 15% of men and 42% of women in this nationally representative survey from South Africa. Rodent studies suggest that this could be carcinogenic. Of course, we're not just big rodents that walk on two legs. So we don't know how true that is, but at least there's some concern about it. This is irregular bleaching. You can see how the knuckles didn't bleach, didn't lighten, but the skin in between did. And that does not make for a good cosmetic outcome. Exogenous ochronosis, these are cases from the United States. So this isn't just overseas. And I'm going to show you a couple pictures of my patients who presented with exogenous ochronosis from using low concentration hydroquinone over extended periods of time. This is very, very difficult to treat, although several lasers are efficacious. Q-switch neodymium YAG, Q-switch 755 alexandrite lasers, in my hands, are best. But it's very difficult to make this normal. The first woman with the two pictures is from India. The lady is from Central America. Mercury is commonly found in whitening compounds manufactured everywhere else but the US and sold illegally even in countries where it's completely banned. That's true of the US, EU, UK, Australia, Canada, South Africa, several African countries. But you can find mercury-containing lightening compounds in small shops catering to foreign wares and informal markets, even in this country. Even in those 4 shops I visited here in Houston. They're often available on the internet at a low price, or they may be brought into the US by travelers, immigrants, students, business people. In a 2018 study of 300 plus products from 22 countries, lightening skin products, 10% contain mercury. 1 part per million, remember that, is considered toxic. But the products in this study were 93 to 16,000 parts per million. And in this interesting study, looking at products that were bought in stores or online in the United States and in several other countries, 6% of all these serums and creams and masks and toners and lotions, emulsions, gels, liquid, powders, oils, and sticks claim to be for the purpose of lightening the skin. 6% of all of them that they looked at, 3 1/3% bought in the United States had mercury over 1,000 parts per million. Remember, 1 is toxic. And it was equal, those that you could get online, those that were in stores. So stores aren't at all filtering these. Almost half of those with mercury that were positive had over 10,000, the highest being 45,622 parts per million. That's 45,000 times the FDA upper safe limit. 45,000 times. And it's not just the people who are using these lightening creams. This is a report from California and Virginia looking at household contacts of those who use skin lightening creams, and 50% of them had detectable urinary mercury levels above the toxic lower limit. And the creams that they were looking at here had mercury concentrations of 20 and 57,000 parts per million. 1 part per million is toxic. So what's in these? Well, there are all these mercury salts. The most common and popular are mercurous or mercuric chloride, but there are other mercury salts. You can find this out if someone's using mercury in a skin lightening product by looking at a urine spot mercury. Anything above 20 micrograms per liter is toxic. What's toxicity from mercury? Topical. You can have skin eruptions, everything from red skin to bullous disorders. You can see dyschromia, acute contact dermatitis. But mercury can be absorbed from the skin, from skin lightening agents in sufficient quantity to cause kidney damage, including the nephrotic syndrome. It increases the risk for cutaneous infections, enough can be absorbed to cause CNS effects, including anxiety, depression, true psychosis, insomnia, headaches, dementia, and seizures, peripheral neuropathy, numbness and tingling, dysgeusia, and you have to use chelators over an extended period of time to try and reduce the body load of mercury. All of these are from topical mercury-containing lightening agents that you might not even know contain mercury because the labeling is so inaccurate. And these are a couple examples of mercury-containing lightening agents that cause cutaneous problems without the individuals knowing that what they were using contained mercury. And I've listed some of these, and you can look them up on when you have the syllabus. Lots of examples of systemic toxicity, including the big one down there from California. Now, there is an international agreement signed in 2017, 114 countries have ratified it, that said that after 2020, they will ban the manufacture, the import, or the export of cosmetics with mercury content above 1 part per million. And that include all skin lightening products, regardless of type. Great on paper. But in 2020, in an investigative report done in Manila, they went in street markets and they pulled stuff off the shelf. And all of these products, the ones that are on that case, the ones that are on the table, were found to contain mercury. If you look really, really closely, you'll see there's the Goree product with mercury in it. The new one. And let's talk about glutathione, which is the current craze. This is a natural tripeptide antioxidant. It's sometimes called the master body antioxidant, synthesized by us in our body from glutamine, glycine, and cysteine. And it's found in our cells in the same concentration as, say, glucose or potassium. So it is a natural product. And it has roles. I'm not going to read these all, but biologic roles that are very important. And it actually has been used as a medication, in some cases to reduce the toxicity of chemotherapy, for example, to help a variety of pulmonary disorders, to help hepatic disease, and even Alzheimer's disease. But how about making lots of glutathione in the body by putting it into the body, either topically or orally or IM or IV? Well, if you do that, theoretically, it can lighten the skin tone. By inactivating tyrosinase, it chelates copper, which is important for that enzyme to work. It interferes with tyrosine transportation to the premelanasome. And probably most important is number 4, which we've mentioned, switching the pathway from eumelanin to pheomelanin. Over time, administration of glutathione can in fact lighten the skin. But an exhaustive review done by your speaker showed that there's not a whole lot of scientifically reliable studies. There is some effect at very high oral doses with topical application at 2% and a frequent, because it has a very short half-life, IV drip, 600 to 1500 milligrams per infusion. This is not approved for any cosmetic use anywhere in the world. Oral supplements, however, as I mentioned, you can get enough in there, at least based on one sort of low-powered study, to lighten the skin. You can get these online or in stores. In fact, I went to Amazon Prime and look, with no trouble at all, I found lots of glutathione orally available without a prescription, without supervision. IV glutathione is available online in kits with instructions The quality is not regulated. This isn't an approved drug. And in some countries like the Philippines, it's done by healthcare providers. I showed you an example, Balo Group. Under supervision, it's done by moonlighting nurses, driving to people's homes, setting up a home IV. And you can go on YouTube and find any number of video instructions how people self-administer the glutathione they bought online, not knowing really what they're getting. So what's the risk of all this, you say? Well, you can be infected. You can get septic. These have all been reported. You can acquire HIV, hepatitis, syphilis. The glutathione may be contaminated with other chemicals, and too much glutathione is too much of a good thing. You can develop renal failure and irreversible hepatic injury, but people can get this IV online in kits, including IV administration kits, and they watch a YouTube video and just do this. These are examples of IV glutathione drip being done in doctors' offices, but you can go online just like I did and just buy your glutathione. God only knows what you're getting. Look at this one. I love this advertisement because they show the FDA in there. Like the FDA approved this. Of course, the FDA didn't approve this. That FDA is an approver of this Empower Pharmacy as a compounding pharmacy for prescription agents, which this is not. And where is it located? Right in my backyard. And you can call them up and buy your own glutathione. Endotoxin poisoning related to contaminated glutathione infusions. All those infections. Hepatorenal damage from something that's designed to lighten the skin. And these are just plain unsafe. This was another YouTube video. I had to share it. This woman says, I'm going to show you how I self-inject glutathione. And she proceeds to show how to give an IV injection of glutathione and tells you some places you can get it online. Steroids, as we know, interfere with melanocyte function. Not entirely sure. Probably tyrosinase interruption. Most of the time, these are ultra-potent topical steroids. They're halobetasol or clobetasol, more clobetasol. And use has been estimated up to 350 grams a month. That's 6 60-gram tubes a month. You all know what topical steroids can do. And these are topical, and they're included in a lot of those over-the-counter, even the popular skin lightening drugs. Atrophy, stria, acne, tinea, hypertrichosis, adrenal suppression, Cushing's disease, hypertension, and induction of type 2 diabetes have all been reported. There are some of the references from skin lightening products acquired without a prescription and with no supervision all over the world, including here. There's one, the two pictures are from a journal article, and the other one is my patient. She came in wanting me to fix this, and seeing those really horrible stria in a place you don't expect to see them, for example, from pregnancy. I said, are you putting something on your skin? And you can see her skin looks kind of a little light and a little uneven. And she said, yes, I'm using this cream to lighten my skin. And in the list of contents was clobetasol. And that's what you can get from using topical steroids, with or without your knowledge or understanding of what you're putting on the skin. Here's another one. This gentleman is using a clobetasol containing cream to lighten his skin, and look what he's got. Patchy depigmentation. And these are from a journal, Indian Dermatology online journal. These women were using steroid-containing creams for fairly long periods of time. One is growing hair on her face. She's not quite like me, but she's getting there. And the other has a pretty nasty acneiform eruption from the steroids in skin lightening creams. So in conclusion, this is an ancient tradition, mostly because it's associated with power, wealth, and it persists today. Effects to lighten the skin are common and global. Yes, they're common in places like India, in the Philippines, South Africa, and other countries. But we see patients from those countries, whether they're here for a short period or they've moved here, or they're the second or third generation living in the United States, where cultural traditions may persist. So this is not just a problem in the Philippines or in India or in Africa. It's a problem here, and we have no idea how pervasive it really is. Remember my 42%, down and dirty, quick just to get an idea study. The motivation's complex, we've discussed that. Shadeism is a modern day kind of discrimination related to long ago colonialism, where the shade of the skin, not the ethnicity or the racial background, but just the shade of the skin may make a difference. And look at the differences it made. Everything from income to sentencing patterns in US courts. Various topical, oral, and IV agents are used. They're variably effective. We've gone through the most important ones. But remember, for all of these agents, there are potential skin and systemic risks involved. Some very severe, even life-threatening. The latest craze includes the IV injection of glutathione. Yes, it's a natural product, but arsenic is natural too, isn't it? For many of the products that are available online or in stores or in street flea markets, it's difficult to determine anything with certainty, where the product came from, what's in it, which makes risk assessment almost impossible. And that brings me to the final point, which is us, healthcare providers. If you find out, if the patient tells you, if you suspect, you have to think about the risks of these agents, and you have to be sensitive to the desires, the wants, the traditions, the cultural patterns of that patient. But in a socially sensitive way, you need to explain the dangers inherent, regardless of whether it's a topical, an oral, or an IV skin lightening agent. There is danger lurking around the corner, and it's our duty in a sensitive, considerate way to warn our patients about this practice. These are some of the references. Of course, this will be in your syllabus, and the other references are in the talk itself. This was a very interesting thing to research. I went to corners of the internet I personally have not been to before, and I really hope that I've helped share what I learned with you, and that will make a difference. Thank you very much for your kind attention.
That was excellent. I tell you, I think all of us in the audience are giving you a standing ovation for such an extensive review. We've had one comment that we couldn't have picked a better person to review this information, and I don't think we really hear much about this. So you're going to have to take it on the road.
Well, I've already several meetings that I've agreed to speak at, I've already suggested this as a topic. I will tell you, Pam, though, it's interesting.
It is.
I've had some takers, and I've had some people say, this is not important enough.
Wow.
And that shows exactly what you were talking about earlier, that there is bias and there's deliberate ignoring of medical disparities, because here we're ignoring something that's dangerous because it occurs predominantly in groups that may not be as significant to those healthcare providers. When an organization says this isn't important enough, I don't know what to say.
Right. We're going to have to sound the alarm. But Dr. McLawhorn, do you have any questions in the chat?
Yes, I do.
Okay.
And thank you again for that wonderful talk. Questions that have come through the chat have included, what are your thoughts regarding the exogenous ochronosis from hydroquinone being attributable to contaminants? And do you think that the risk is negligible or lessened?
Right.
So
That's a hard, it's an important but a hard question to answer. And some people have said that and have presented some evidence that it may be contaminants, but there are other people who have shown by very sophisticated biochemical means that what we're seeing, those, you know, brownish, goldish things in the skin, is hydroquinone. So does it really matter if it's a contaminant that appears during the synthesis of hydroquinone or it's hydroquinone itself? Any product that contains hydroquinone should be suspect and should be used under the direction of a medical professional and in a circumspect manner, not forever unsupervised. That's the message here. Because when you get this, I showed you my two worst patients. I've had some that weren't so bad. But when I try to reverse this, even with, I have lasers, I do lasers, the only cosmetic thing I do. When I've had the right laser on the right setting with a very, very good patient who come in 4, 6, 8 times, I didn't even charge because I wanted to see whether I could help. It's very difficult. You can make it better, but it's hard to make normal skin again. So the best treatment is prevention.
Great segue into kind of our next question that's come up, and that is there a role for screening in certain groups to prevent bad outcomes, or i.e. should providers be asking patients who do not present, you know, for these particular concerns, but ask them about skin conditions?
So the answer is yes, and I put my mouth where I put my money where my mouth is. Okay, so it's like, you know, I usually talk a lot about infectious diseases, and I've changed my intake form over the years. I've been doing this for 43 years, and I put things on like, have you been exposed to animals? And I've asked for travel within the last year. I never used to have those on my intake form. I now have on my intake form a specific question. Do you or have you used any topical, oral, or systemic, I put intravenous, medications with or without a prescription with the intent of lightening your skin tone? That's now on my intake form, because if somebody's not having problems today, doesn't mean they won't have problems tomorrow. And if they're not having problems today, they may not tell you. And this also goes back to something I think we're going to talk a little bit about later when we talk about the diversity champions and allyship and those sorts of things. But, you know, patients who might be using these might not trust their healthcare provider, including their dermatologist, to be completely frank and completely open about everything they're doing, because they might think, in fact, some of my patients have told me, till they get to know me, like when they're new, well, I didn't think you'd appreciate that I'm doing this. I thought you would shame me, so I didn't tell you. Till they get to know me and they realize I'm okay. But yes, I think the way to prevent is to find out. And the only way to find stuff out sometimes, and this isn't just for this, it's for a lot of things, is to directly ask in a non-confrontational, non-judgmental way. You just need to know, so because you're delivering healthcare to the skin, you need to know everything they're doing to their skin.
Very well put.
Excellent.
Thank you, Dr. Rosen.
All right. Well, I tell you, we could spend a few more hours with you and discuss this, but we will continue on with our program. Thank you so much. You
My
have
pleasure.
been a wonderful source of information for us today.